Hello, everyone, and welcome to the Kindland Report. I'm your host, Leon Bibb. You know, in Yiddish, the word mensch is defined as a kind, considerate person of integrity and morality and dignity with a sense of what is right and what is responsible. This term has been used by many to describe my guest today, and rightly so. As Chief Clinical and Scientific Officer and President of Academic and External Affairs for University Hospital's Cleveland Medical Center, Dr. Daniel Simon combines a wealth of knowledge and leadership skills with the values and the ethics and kindness that mensch implies. Welcome to the show, Dr.
Thank you,
Daniel
Leon.
Simon.
Thank you.
Good to have you with us. Let's talk a little bit about this thing called kindness and all of that. Let me ask you, as a leading research scientist and practicing cardiologist, you have a deep interest, obviously, in the human heart. How does kindness guide your leadership and your research in all of that?
Well, Leon, that's really a great question. I think when one goes into medicine, you're really pursuing a career which ultimately is really for the benefit of the patient and the family in front of you. And I think everything that we do, even as clinicians taking care of patients or as researchers hoping to make discoveries that will impact patient care and bring it really back from the bench, to the bedside, is really all about curing, preventing, or dealing with chronic disease. And that takes compassion and kindness.
You use the word bedside. You're reading my mind because I'm thinking about bedside manner. And when you're talking to a patient who's going to need cardiac surgery, this is a heavy subject. You have to think about kindness when you talk to that person, even before you get into the surgery room, correct?
It's really important to establish an intimate connection with a patient. And one of the things that we're taught by our mentors is to really sit down when you talk to a patient, sit at the foot of their bed, and to really touch their ankle or their shin. Establish a physical connection with the patient that shows caring and empathy for them. That connection, that looking at the patient at their level and talking to them in language that they understand, is really important for establishing respect for the patient, but also confidence that you're making the right decisions for them.
You also oversee University Hospital's graduate medical education programs. Tell me a little bit about the duties.
Our mission is to heal, to teach, and to discover. So 1/3 of our mission is about training the next generation of physician, the next generation of doctor or allied health professional, such as a physical or occupational therapist. We have a duty and an obligation to train the next generation, not only for our community, but for communities beyond.
You have to wear more than one hat then. You're not only telling the next generation of doctors about the medical procedures, the physical things that they have to do, but there's that other side, as we talked about earlier, of actually touching the patient's heart, if I can use that phrase.
Right. Well, we have amazing core faculty at university hospitals, which really dedicate their careers to being what we call clinician educators. And it's those physicians who serve as role models, teaching medical students, teaching interns and residents early in their training, not only how to talk to patients and to their families, but also how to talk to their mutual caregivers. How do you form an effective team to take care of the patient and the family in front of you?
When they ask you, Dr. Simon, why is this important that I know this aspect of medicine? What do you tell them?
What we try to tell our trainees is that they're doing more than caring for the specialty that they're in or the body system that they're specializing in. They need to understand that 80% of the health of a patient is determined outside the hospital, the social determinants of health. Only 20% is clinical. You need to know about the patient's social situation. Where do they live? Do they have enough food to eat? What are they facing from challenges?
You have to study that patient's life, not only the patient's physical problem that you're dealing with, but you need to know where that patient is coming from, what's happening on the home front before they even get to the hospital.
Absolutely. And one of the most effective ways of doing that, Leon, is by working with the family.
What makes a good medical person, whether that's a medical doctor like you or a nurse or another caregiver?
The knowledge is foundational. Those are sort of the table stakes. What makes someone an effective caregiver is listening skills. Really have to be able to understand how can you meet your patient where they're coming from to come up with a shared decision-making plan for their care that will meet their needs.
Do you take this thought process outside of the hospital?
Well, one of the responsibilities of leadership at university hospitals is that you're always on call. And I think that you can, talk to my patients and friends and probably my wife who sees it the most, which is that when we go out, you're always there for people. I get texts all day and all night for health problems, trying to get people access to health care. They're in a time of need. They're desperate. They're looking for hope. And what they see in the leaders of university hospitals is the opportunity for you to connect them with a solution to their problem.
Once people find out you're a medical doctor at university hospitals, they might even say, well, doctor, I've got this problem. Can you tell me about, you may be at a cocktail party, you may be at dinner, you may be at the theater or something. You have to deal with that person on a one-to-one basis, even if you can give them a minute or so.
Well, I think you have a responsibility. When you become a physician, you've made a decision that you're really committed to the health of all people. And I find that it's really my responsibility along the aspects of, why potentially we're here today. Kindness, caring, and respect. Really, that's what it's all about. And I think being a compassionate leader is to help people when they need help, anytime that is.
In your years as a medical specialist, have you seen medicine changing, moving into a different direction involving the things that we're talking about today?
Medicine is moving in a lot of new directions, some good and some not so good. I think the good thing about medicine is the development of incredible, minimally invasive and non-surgical approaches for disease. Medical technologies are changing at such a rapid phase that we're able now to treat many conditions as almost outpatients or just brief overnight admissions. That's the good part of medicine. New drugs, new devices, and new cell-based therapies that really impact patients positively. The not so good part of medicine that's happened over the recent years is the unbelievable administrative burden of practicing medicine. The rules and the regulations that take the caregiver away from the patient and have them deal with enormous paperwork. The other thing is that medicine is very hyper-specialized now. Care can be uncoordinated and a little disjointed. And one of the things that we really look for in our caregivers at university hospitals is coordinated care, over-communication, and linking us one doctor to the next.
How do you deal with all of that?
Well, one of the things, Leon, that you have to understand today is that medicine is a team sport. It's interprofessional and multidisciplinary. It's doctors working with pharmacists, with nurses, with nurse practitioners, with social workers, and care coordinators. It's making sure that what happens in the hospital continues at home.
You've got to be kind to your staff, kind to those who work with you, because they've got a working relationship with Dr. Daniel Simon or whoever they're working with, right? So you've got to bring that, as we talk about kindness in this series of reports, you've got to take that kindness approach, not only from the patient, but to the people around you.
Absolutely. We have 33,000 caregivers in the university hospital's health system, and each one of them plays a role in the care of the patient in front of you. From the valet parker who first meets the patient and immediately can set them at ease in coming to the hospital, all the way to the final doctor's office where an MA is registering the patient.
Give me a final thought on the importance of kindness in the work that you do and the mission that you're on.
You started out referring to a Yiddish expression of mensch, and I think that it really reminds me, I think, of one of the main principles of Judaism, and that is one of what we call chesed, which is loving kindness. Everything that we do, that we try to do, is based in that principle of loving kindness. And our responsibility on earth is to repair the world, make the world a better place. Every day that you go to work, can you do something, some little thing, that will make it better for someone that day. I think what's great about being a physician is that you have the opportunity to do big things. I was very fortunate as an interventional cardiologist to take care of patients with heart attack. The artery's blocked, they're facing death, and you open that artery with a stent. And you and the team feel very fortunate that you saved somebody's life. That's why medicine is so special. It gives you the opportunity to not just do little things, but to also do big things.
Is there anything I need to know, Dr. Daniel Simon of University Hospitals, that I have not asked you that you think is important to what we're talking about as we look at this foundation of kindness in your life and in your work?
We have to come together as a community, this health system, the other health systems in town, and really understand that Cleveland has a lot of need, and we need to work together to address those. That's what Kindland's all about, and we're going to get there.
We appreciate you talking with us.
Thank you, Leon.
We've been talking with Dr. Daniel Simon of University Hospitals. He is President of Academic and External Affairs and Chief Scientific Officer in Healthcare Leadership. He's been talking about kindness and the role that kindness plays in healthcare. He admitted that he too was a mensch, meaning that a man of high integrity and morality who looks for things that are right and responsible, bringing all of that into his job as a surgeon, as a medical man, as a hospital leader here at University Hospitals. That's going to do it for us on this Kindland Report. I'm Leon Bibb.